Hi, my name is Dr. Pepperbottom, and I'm an expert. I'm here to talk to you about stroke. CVA, or cerebral vascular accident, is when an artery going to or within the brain bursts or is blocked. At age 55, one's risk of stroke doubles for each decade. Stroke is the fourth leading cause of death in the US and the first leading cause of disability. If one of your family members has ever had a stroke, you're that much more likely to have one as well. Some strokes may be symptoms of genetic disorders that damage brain arteries. More women than men experience stroke and die from them as well. Pregnancy, history of pregnancy, post-menopausal hormone therapy may also pose special stroke risk for women. Prior stroke sufferers are at much higher risk of having another stroke. TIAs, or those of you that don't know, transient ischemic attacks, are strong predictors of stroke, and TIA sufferers are 10 times more likely to suffer from a stroke. Heart attacks? Yeah, those play a factor as well. The number one risk factor of suffering a stroke is hypertension.
Hey Mom, where's the salt?
Followed by diabetes,
And the sugar?
peripheral and carotid artery disease,
No sugar?
arterial fibrillation, and other heart
Can't
diseases.
get anything here!
Sickle cell anemia and high blood cholesterol are also risk factors. Some preventable risk factors include cigarette smoking, poor diet, physical inactivity or obesity, and alcohol and drug abuse. Too much of anything, unless it's research, is bad. There are two major kinds of strokes. One is an ischemic stroke, which is a blood vessel supplying blood to the brain being blocked by a thrombotic clot. A thrombotic clot is a clot that forms in an artery that is already narrow, or an embotic clot, which breaks off from another area and travels to the brain. Ischemic strokes account for 85% of strokes. Dr. Pepperbottom. A hemorrhagic stroke is when a blood vessel in the brain bursts, causing blood leakage into the brain. There are intracerebral hemorrhages, which occur when a blood vessel bursts into surrounding brain tissue. A subarachnoid hemorrhage occurs when the artery on or near the brain's surface bursts and spills into, you guessed it, the subarachnoid space. TIAs, or in case you still haven't heard, transient ischemic attacks, are also known as mini strokes and morning strokes. These are temporary disruptions in blood flow to the brain. They often last for less than 5 minutes, and their symptoms last anywhere for less than an hour to up to 24 hours. They are considered signs of an increased risk of permanent stroke and an emergency. Patients should be seen immediately by me. Some signs and symptoms include sudden weakness, or confusion, or trouble understanding. Do you know how to determine if someone is having a stroke? Of course not. I do. Remember the acronym FAST. I'll say it again. FAST. I'll say it again. FAST. I'll say it again. FAST. F for face. Smile. Is one side drooping? A for arms. Raise them. Is one side weak? S for speech. Say a simple sentence. This guy's hot. Do you slur? Is it clear? Are you able to? T for time. Don't waste any. The more time wasted may mean further permanent brain damage. The effects of stroke depend on the type of stroke and what part of the brain was damaged. To simplify, there are 5 types of disability: paralysis or loss of motor control, sensory disturbances that may include pain, inability to speak or understand speech, disturbances in thinking and memory, and emotional disturbances. It has been your pleasure listening to me speak to you about stroke. If you have any further questions, don't call me. I'm busy that day. Look at the American Heart Association and the American Stroke Association websites or call 1-888-4-STROKE.